Morgan Smith is a 16-year-old working at Walmart, where her father was able to get her a job. Over the past couple of weeks, Morgan has become increasingly irritable and aggressive. She is currently in the pre-contemplation stage of change because, thus far, she has been able to control her temper. But that is all about to change.
Wow, Morgan, that looks great. But you've used the wrong cups. You're gonna have to do it all over again.
Are you freaking kidding me? Morgan is still in the pre-contemplation stage. This incident at work gets back to Morgan's mother, and the following event occurs at home.
Morgan, how are you? I heard what happened today at work. Would you like to talk about it at all?
No, I don't.
Are you sure? I'm really concerned.
No, I don't want to talk about it, Mom. Just leave me alone.
This, in turn, landed her in the hospital with a broken wrist. We find her now in the middle of an assessment with a nurse.
Hi, Morgan. I'm Courtney. So, can you tell me about how you broke your wrist?
She hit the wall. I was with her. She hit the wall.
And Morgan, can you tell me why you hit the wall?
I can explain for Morgan. She's been really irritable and angry lately, and I think it honestly has a link with how she's been going to the gym. She's been really obsessed with going to the gym, and I'm surprised it hasn't gotten to this point sooner.
Okay. Mrs. Smith, would you mind stepping out of the room? I'd like to ask your daughter a few questions.
I don't think Morgan would be comfortable with that. She wants him here.
Mom, just go.
Morgan, is it okay if I ask you a few questions?
Yeah, that's fine.
It'll just stay between us. In the past year, have you used any street drugs such as heroin?
No.
Do you smoke tobacco?
No, I hate that stuff.
Do you drink alcohol?
No, I don't want it to mess up my competitions.
Okay. What about prescription drugs? Have you used drugs like steroids in the last year?
Yeah, but who hasn't?
I'm concerned with that you find it necessary to use non-prescribed steroids. Will you tell me why you think you need to use steroids?
Well, I just feel like, see, my dad's a bodybuilder, and I feel like I want to be, he puts me in these competitions, and I want to do well in them, so to become stronger, I need to use these steroids.
I see. So it sounds like you feel pressure from your father, and you want to make him proud.
Yeah, but no, I do it for myself, because I want to be stronger, and I want to do well in these competitions, but now I can't because...
I understand. So, is it okay if I offer you some advice and give you some information?
Yeah, that's fine.
Well, with any competitive sport, the use of steroids is illegal. If they do a drug screen, they won't let you compete. Also, the continued use of steroids does have long-term effects, such as an increased risk of heart attacks and strokes. I'd like you to consider stopping your use of steroids.
I can try that, I guess.
Will it be difficult with the gym that you go to?
Yeah, because, like, the people who are at the gym, the people who gave me the steroids, they gave me the steroids, so it'd be hard because they'll be pressuring me to give them to them, and I don't know if I can resist that because...
Right, I can understand they'll want you to keep taking them. Have you ever considered getting a different memberships at a different gym?
I haven't, but I don't really want to because it's the cheapest in town, and like a bunch of my friends go there, and I enjoy going there.
Right. Well, have you ever considered if it's still the cheapest after you purchase the steroids?
I haven't thought about that.
Morgan has now now move to the contemplation stage.
Okay, good. So you're thinking about it a bit. Here is some more to think about. Did you know that one of the effects of steroid use is irritability and rage? Were you angry when you punched the wall?
Yeah.
Can you describe how you felt before you ever started taking steroids?
Well, I used to be a happy person and never got, like, not never, but I never got as angry as I do now or irritated.
So what do you think would be different if you had never taken steroids?
Well, I definitely wouldn't be in here right now, and I'd still be able to compete.
And so, what do you think is most important to you? Being able to compete or your mood and your happiness?
Probably my mood in the long run, because I really don't want to hurt someone.
So what do you think is the worst thing that could happen if you keep taking the steroids?
Well, I could really hurt someone, and I definitely don't want to do that.
Right, and you might get disqualified. So do you think it is worth it to keep taking the steroids?
No, definitely not.
Do you think on a scale of 1 to 10, can you tell me where you're at, with 1 being I'm not ready to stop at all, and 10 being I'm definitely ready? Where do you think you are?
8. Definitely an 8. But
Great.
when I came in here, I was definitely 2, so.
Well, that's great, Morgan. You sound confident, and I know that you can do it. Would you like to work on a plan with me to get you off the steroids?
Yeah, that would be helpful.
Okay, well, you shouldn't quit cold turkey because that could be dangerous. So for starters, I'll need to kind of know how much you've been taking so that the doctor can decide the best way to decrease that.
Okay, I take about 1 pill a day.
Okay, well, we can address that. Do you have any way that might help you to stop taking the steroids?
Well, probably changing gyms like you suggested, and then working out with my hand, like not.
Right.
Yeah.
It'll be difficult to lift the same amount of weight that you've been using. So we can work on a plan for that. I know how you feel. When I broke my wrist in basketball, I didn't get to play for a month because I wasn't able to shoot. So you could try doing some exercises that will help you keep working those muscles so that they won't decrease. I can set up an appointment with you with a physical therapist if you'd like.
Yeah, that would be super helpful. And thanks.
No problem. Okay, we'll schedule you for a follow-up to monitor your progress in about 2 weeks. Does that sound okay?
Yep.
So just a reminder, the doctor will come in and see you, and you will be given a prescription for your reduction plan. If you have any questions, here's the clinic's phone number, and we'll see you in about 2 weeks.
Morgan has progressed from the pre-contemplation to preparation and has decided not to take steroids unless she truly needs them for a medical purpose. She is a compliant patient and successfully stopped steroid use in the month following her appointment, originally for her wrist. Once healed, she returns to her competition drug-free and does well, even without her supplements.